I would like to tell you a little bit more about my poster. The aim of the present study was to identify psychological variables who are predictive for a greater therapy effect in regard to pain-related disability after an interdisciplinary rehabilitation program. So I used a data set of 751 patients with chronic musculoskeletal pain complaints who followed an interdisciplinary rehabilitation program of 10 or 20 weeks. The possible predictors were the screening questionnaires that were filled out at baseline. So we had measures of fear of movement using the TSK. We have the CIS, which is a measure for fatigue. We have the BDA, which is a measure for depression. We have the UCL, which tells us a bit more about the coping mechanisms of the patient. And last possible predictor was the SEL90, which gives us an idea of other psychological and physical symptoms. As outcome measure, I used the change in PDI score, the Pain Disability Index, before and after the treatment. So I found that only the CIS and a subscale of the UCL, namely emotions, and one subscale of the SEL90, namely hostility, were predictive for a greater therapy effect. So which means a higher score in these questionnaires or subscales of questionnaires at baseline are predictive for a greater reduction in PDI score at the end of the treatment, so which means a better therapy effect. So I concluded that assessing psychological factors such as fatigue, anger and annoyance, but also hostility at screening can help to predict the success of an interdisciplinary rehabilitation program. Thank you a lot. I hope I learned you something new.